Hi, this is Dr. Dreesen, and I want to welcome you to our Producing PEMF Professionals program. And today I had the opportunity to interview Dr. Joseph Toy, who is up in Canada. Dr. Toy is recognized as a neurostimulation specialist and mental health recovery mentor. He has been treating military vets with PTSD and has been certified in PEMF through the Medical Protocol Specialist from Canadian University in Dubai. And he's been doing great things with PEMF for a long time. And you'll see in my interview, he's like, well, not a lot of people have PTSD because we treat them for it with PEMF. And it's like, that was like, what? You've been doing this, and we're just starting to do it here. But I had a chance to talk with him, and this is our interview, and he shares his process and his vision about PEMF technology and a lot of its therapeutic advantages based on his actual patient experience. For you, using PEMF in your story, how did you get started with PEMF? I didn't know anything about PEMF, and then this happened, and then I started using it.
Mhm. Okay, actually, it's a research project at the National Defense Department in Canada who was looking forward to find a solution to PTSD because our soldiers were coming back from Iraq, Afghanistan, and they were all messed up. So started from there. So I spoke to different generals and people working with the militaries already, and at some point, I've met like General Dequin from the French army, who actually told me that in France, the soldier didn't have any PTSD because because they were well prepared and they had neurostimulation. So of course, I thought that was kind of funny because like PTSD, it's everywhere. It's not like only in Canada and in the US. So, but the thing that triggered me was like him saying that about neurostimulation. So I was like, whoa, what's going on? What is that neurostimulation? And this is when I started to dig like further into finding a way to know more about neurostimulation. And then I had a meeting in Ottawa a few years ago with Dr. Keller. I think she was working with the Marine Corps, and she was already using neurostimulation as well. So I thought, okay, so there's something over there. So and then I decided to start searching about that and be creative.
So these people, the military, they were using it while they were involved in the military, or this was all after they left.
No, it was actually after they left. So
Okay.
the thing is that they were. It's more common into the Veterans Affairs. So even like in my case, the use of the program was more about the Veterans Affairs than the National Defense Department, because at the National Defense Department, it's all about research, and of course they want to find a new way to treat and support the soldiers, but it, at the other hand, they don't want to allow them to say that, oh, we're not getting our people prepared enough, so they come back with PTSD. You see, there is like something there that is it's a mixed feelings because they want the best soldier as possible they could as possible as they could be. But the thing is that they don't want to say that when they come back they have a problem.
Right. Yeah, that's we see that too, like here in America, like the one of the biggest things that just got, finally recognized were the big burn pits, and all of the health, problems that it caused. It's like, nah, they don't cause any kind of problems. And now, there's finally, it got brought to light, but it seems like there is this, blinder mentality where there's nothing wrong. It's just
Mm-hmm.
them, because there are other people that don't have it, so therefore it's not prevalent. But that, we see that on both sides. So to me, that's kind of a new thing where they're actually saying, yes, we recognize this, and here's the protocol we recommend because we know it works. I mean, there's two things right there that are happening that are unheard of on a large body, especially military. So for you, are they sending you soldiers to work on, or do you like market how to do this?
Yeah,
How does this work for
no,
you?
yeah, no. Actually, it's part of the Veterans Affairs mechanism. Like, it is an insured modality now. So the only thing they need to know that what we were doing first, and they can refer. They are referring people, and the veterans, like, all by themselves, they are word of mouth. They are speaking to each other, and so of course there's a lot of people coming from that department.
Right. So insurance is paying for it. So when a military vet is having PTSD, there's some sort of a pamphlet that they get saying you should try PEMF, and then here's where you go to get it.
Uh,
I mean, how does that?
it would be too good to be
Yeah,
true, but
right.
actually, but actually, it's not the case. They need to ask about that. So when they come to the clinic, because people are talking, so and the veterans are well known to be speaking to each other and get insight, like,
All
within
right.
their own. And I'm part of the Royal Canadian Legion, so by just going around and do some speech, they get to know that, and now they can say, okay, just you need to call back the Legion because you're covered on this. But
Right.
because other than that, they won't say it like at large, but it's part of it. They don't agree with it, but you need to ask for it.
So for you, when did you? I mean, when did you get your first machine? And did you just start doing PTSD right away, or did you like branch out and do other parts of the body?
Yeah, no, actually, when I started, I was like with working with a teacher at the Laval University Medical School in Quebec City, and she was aware of neurostimulation as well, so she knew a little bit about that. And we start doing like different things like chronic pain and acute pain, and that was about it. And then things came deeper, like some people coming in for Alzheimer, Parkinson, and so on and so on. But this like was like more the beginning of the whole process I did afterward, because like I went back to study in Switzerland because I found a place that they were teaching about
Right.
PMF. But
Right. Because you
and
got
then
certified. You got certification in, was it Dubai? Is that?
at the Canadian University Dubai, yeah, as a PMF medical protocol specialist.
And how many people have gone through that program? It's
I think it's around like 25. Yeah.
and when did that start? How long has that been in available?
Yeah, I was kind of lucky because actually it was part of the university trying to get into medical, like they were thinking about opening like medical department, and they were trying different things. And PMF came in because of a suggestion of one of their doctors over there.
Right.
And yeah, that's how I got there. And they first asked me to teach with them in collaboration, which I did. And yeah, that gave me the possibility to meet like different people aware of PMF from different part of the European, like side of the world.
So walk me through a typical vet that shows up and says, "Hey, I'm here for the PTSD protocol. What's your recipe, or what's your what's your consult, your exam, and your
Mm-hmm.
treatment protocols?"
Yeah, actually, when they come into the clinic, they never say they come for PTSD first. They always come and saying, "Oh, I got pain in my back, my knees. I used to be a military. You know what it is." I don't know. Nobody's talking about PTSD, so I was like, "Oh yeah, I know what it is." Like, meaning PTSD was.
Right.
So
Yeah.
and even like when I'm treating them, they often ask me about what are you doing now? Are you treating PTSD or something else? No, you told me about your back pain, so I'm treating back pain. So that's basically it.
But you have
And
to
what
wear
they
this on your head in order for me to treat your back pain. Is that is that what you do?
no, I found different ways to be able to get there, because actually PTSD is for me. I'm taking like the central nervous system road to it, and you can actually work on the
Right.
back or even down the feet, so that's what I'm doing first. And then because you're asking me when it starts, but of course, after 4 or 5 hours, they get to know me, and now they can loosen their guards. And now
Yes.
we're starting talking about PTSD, and now we can move to the head. So that's how it goes. And then they start like being confident into the process.
And what kind of results have you been getting by using? Obviously, it's like you said, it's a matter of trust, whether or not they
Mm-hmm.
can open up to you and let them know that they have this. So then, once they've been getting that care, then I would assume they're open enough to tell you, hey, since I started this, I don't, you know, cry. I
Mm-hmm.
don't feel like at the drop of a pin, like I want to shoot somebody, or just
Yeah.
all of those things. So are you getting those kinds of feedbacks during their course of care?
Yes, I do, but more oftenly it's about their wives. He actually called me or talked to me like in private, and most of the time they are it's the ladies who talk more about the fact that, oh, okay, thank you very much, you brought my man to me, you brought my man back, or something like that, or he used to sleep outside and now he's getting into the house. And when actually I had the military, he was really sleeping in his car for the last 2 years. He has been sleeping in his car for the last 2 years. And at some point, his wife called me and saying, "Wow, it's the first time he came inside the house and we slept together." So
So what's a typical treating program for you? Is it like 3 times a week or once a week for a half hour, or what's kind of been
yeah,
the sweet spot for this kind of treatment?
yeah, the sweet spot for us is for me is about twice a week, an hour each time. So and some of them like are going to come like 3 times a week. And last week actually, I had like two military from outside of the city. So when they come from outside, of course, we booked like a full time solution for them. So then they do like 2 3 hours every day for 7 days or one day off, and then they come back and then they go back home. So that's about the way we do it.
And how long of a treatment span is it? Is it a couple of weeks or a couple of months or?
Normally, it's about if they are in town, then it's gonna be a couple months, and if they are out of town, it's a matter of 1 or 2 weeks at a time.
Okay. What about like with their diet? Do you help them clean up their diet, or do you have them drink a ton more water, or move over into
Yeah.
like the vitamin D fish oil kind of stuff, or what do you
No,
do?
I don't do that especially, but I'm telling them to drink more water. I don't drink alcohol, especially after like right after the treatment, because we all know it's slowing down the cells. So then it's slowing down the process of what PMF can do for them.
Right.
So basically, that's about it. Because my wife is a nutritionist, and when she's in and they ask for it, she's gonna mention a few things. But on my side, I don't talk much. I'm just giving them the good health advice, like take care of what you're eating. What I'm not saying what to eat, but I'm just saying that it's everything is good to chain together to eating habits, sleeping habits. Try to avoid stress as much as possible. And if you think you're going to be yelling at some point, just take some time off and go on the side. So just giving them some typical advice. I'm not giving them any nutritional advice on my side. Mhm.
And then where you are treating, do you have regulations as to what kind of machines you can use, or have you tried a variety of machines? Do you have one that you prefer as far as the
And,
strength, as far as the Gauss strength or
and
the frequency? Is there any in particular that you think hones in
yeah,
on the PTSD the best?
yeah. Actually, for me, the best is the best answer we can get to PTSD, regard of the cost of the machine, because at the end of the road, that's the patient who's paying for it. So yes, I did use like different branding machine in Canada. I need to use, especially in a clinical like facility, we need to use like a Health Canada approved device,
Right.
which we do. But there's like a few of them. and I did try like four of them like before, and I didn't have like as much as a result as the one I'm using right now, the Curatron. And why I'm using this device, because it's actually it's efficient for the price, you know. And I've been approached by a different company, and even though there is like a company in Georgia who actually are doing like a very nice device. But for me, it's not like it. The problem is it's not Health Canada approved, and it's also more expensive. So
Right.
obviously, especially in Quebec City, it's a province in Canada where all medical expenses are paid back by the government. So it's when people come to the private clinic, they need to. It's an out of pocket. So you really need to be like as cheap as possible and as efficient as possible, because
Right.
people are going to be very critical about the fact that it takes too long or it costs too much, because they
Right.
are not used to pay. It's different. Like I used to live in LA. In LA, people don't bother about that. but,
Yeah.
but in
Right.
Quebec, that's
Big
not the
difference.
case. So
Yeah.
yeah, it's different. So I need to find the best device for the price ratio, so I can deliver the treatment to the patients at a very
Right.
low price. Yeah.
So now, because it is, like an hour, do you have
Mhm.
multiple machines so you can treat, more than one person at a time, or you just see like
Yeah.
one at a time?
No, actually, we do have like 7 rooms and 7 machines, and no, actually 7 rooms and 10 machines, because there is like rooms where we do have like 2 machines, so we can treat like wife, husband at the same time, mom and daughters, or dad and boys. So that's the typical thing happening. So they come together and we treat them together. But yeah, we do like almost 10 people at the same time. Yeah.
Do you see this model being set up and emulated other places where you are, or are you kind of the only
Uh,
people around doing it?
no, I'm the only one doing it, and especially the way I'm using it and the way I'm working it. And I've been very creative about my own protocols. So I'm using them, and it has been proven to be more efficient than the one like pre-programmed I saw on the market
Hmm.
as for now. So no, yeah. So I'm the only one to do that.
And have you been able to, since doing this, have you been able to take this information and start publishing it, or are you creating any kind of documentation on what you're doing and how you're doing it, so that other people
Mhm.
can learn from it, or maybe even replicate your treatment model?
Yeah, I know that I did like I started. I must say I did like a few things, but actually the only one who can replicate what I'm doing is my wife. So, so as for now, I'm overviewing all the clinics. We only do own like 2 clinics, so I'm overviewing. But I have to do that because, like, especially in British Columbia, the health authorities about over there asked me to manage 78 clinics of them. So obviously, I will need to be quick and do it fast.
Right. Wow. Yeah. I guess you need a cloning machine next, right? So that way there can be.
Yeah, I need to find that frequency, which I haven't yet.
So now that you've been, working with this, you know that, of course, PEMF does things other than PTSD. So are you branching out and working on other things for the body, as far as inflammation or irritations, things like that?
Yeah, PTSD was the beginning of the whole process, but actually, as for now, most of our patients are from cancer support program and different type of things like Parkinson, Alzheimer's, and yeah, it's a lot like it's different now. It's not only focused on PTSD.
Right, and you and I both have seen, amazing things that are happening. Even, well, for me, it's like, okay, what can you talk about? What can't you talk about? Because
Mm,
otherwise, you have to be able to say, well, we've got proof. Here it is. Here's the microscope that shows before and after. But over on the animal side, we can see animals being treated and their tumors shrink. We
yeah,
can see, just the reorganization of tissue in a positive way, and we know, like with the the nitric oxide and things like that going into the cellular level, and oxygenating tissue, and creating better transport of energy through a membrane and things like that.
Mm.
Where you are you able to calibrate any of this stuff or measure any of it?
Yeah, I'm using like what the most patients are being followed up by the hospital. So I'm using the hospital MRI and blood test, blood work. That's what I'm doing, and I'm putting the numbers together. And I like to do like a resume of all that, so we can see time wise what's going on. And I'm doing some graphics, and we can
Mm-hmm.
see for
Right.
about like for the immune system support, for example, we could see the things going up, and it's very, especially it's very important for the patient as well, because they could see that PMF is doing something positive to them. Other than that, they will need to be totally confident in you, because like most of them don't feel much what's going on. They
Right.
just fall asleep on the bed, and that's about it. And when you see the MRI changing, or the blood work coming back, and I can show them about the GGT, or the red blood cells going up, and
Right.
are being recalibrated. So then whoa, okay, something's working. So that's how I managed to keep those stats.
Right. Because you're also, yeah, I was talking about today on the live that I did, where a woman put it on her old dog and she ended up with a puppy. It's like, and that was with one treatment. It's like, wow, this is amazing. Are
Mm.
you getting any of the people you're working with after a few treatments, like there's night and day to them, that they notice it as well?
Yeah, some of them like it's like not in one treatment for sure, but yeah, we could see night and day reversal situation, especially when people are in cancer. A few years ago, like I had like many patients coming back from the oncology department being told that they were done. Nothing more could be done with them in oncology. So as the last resort, they came to see me, and then from there, some story changed a lot. So
Yeah, there's
but
just remarkable stuff with PEMF and what
mm,
it does for tumors. Just the whole, like I said, if you can get into that cancer cell and the body can see that it's cancer and not
mm,
itself, then it can start the battle from within, and then
mm,
eradicate it. So it's
yeah,
it's like flipping on the switch for the cells to understand what's going on inside their own body, instead of because the
mm,
cancer does a great job of masking itself off,
mm,
surrounding itself with like cells so the immune system can't see it. But for PEMF, I
yeah.
think does a good job of alerting the system from within inside the
Mm.
tumor to turn it on so it can see that it's surrounded with cancer and begin to eradicate it.
Oh yeah, no, exactly, and it's also like a very good delivery truck for chemotherapy, for example, because like by I'll gonna say that not diminishing, but by melting down the transmembrane potential of the cell, of course, the chemo can get into it so more
Yes.
easily, because
Right.
as you were mentioning, like the cancer cells tend to be harder than the regular cells, and then with PMF they get softer, so chemo can get in more efficiently.
Yeah, that's one of the other things that we talk about is the body's ability to absorb medication better.
Mm,
And especially with PEMF, you can custom, not custom design, but you can customize where you're sending that PEMF into an area so that that
mm,
particular area has better absorbability. So, like you
mm.
said, using the chemo and being able to be more effective with that.
Yeah, no, that's correct. And the thing is that you need to understand the language of the cells you're talking to. So if you're talking about the liver cells, you know that they will be reacting to specific frequencies compared to the intestine or the colon.
Yeah.
So that's when you need to make the switch. So then like I'm always telling people. To Italian, you need to speak Italian, and to Chinese people, you need to speak Chinese. So then you make sure that they understand you. So with the PMF, it's the same but we're using different frequencies to do
Right.
so. Mm.
So we talked about, there's frequently asked questions about what's going on, but there's also what I call should ask questions. So
Mm.
for people that are interested in what you do, what are some of the questions that they should be asking if they want to come and use your services, or PEMF in general for PTSD?
Wow, that's a good one. There are so many different stories in regard of their own story. So most of the time they just come to the clinic. They file like a patient's paper, so we can start the discussion. And I'm always like meeting every one of them. So even if we have to do sometimes like 200 patients in a row, I'll do it, and I'll be around talking to them and get to know their stories. And from there, I can manage like more to think about a strategy, what I'm gonna do with them, what each of them. Because even if you're talking only for PTSD, every one of them has a different stories, so they probably will react differently to PMF. So you want to get like a glimpse of their story to understand, okay, this person probably is going to react more about using that kind of frequency. That's the reason why to treat like different pathologies, there's not one specific frequency for me. There's like different ones, but because it's like a discussion. It's like what we're having right now, but at the cellular level.
Right.
So we start speaking PTSD to with the PTSD protocols, and all of a sudden we realize that it's about pain. So then we switch to pain, and pain is helping PTSD cells to get in movement in the right way. So then, all of a sudden, pain is done. So we need to switch to different frequencies, and now we're talking about like different types of things going on. And at the end of the road, you get rid of PTSD by taking care of something else. Because if the or the brain doesn't work like well, sometimes it's because of the liver or the pancreatic, you know. So
Right.
that's the process of finding the source of the problem.
What other systems
And
need attention?
yeah,
Right.
yeah,
Yeah, that's really good. That's because that's the thing is you can't. I mean, the body's so complex, as you know, and and a certain pain can show up, but there could be five, to 20 different reasons why there's pain there. It's not treating the symptoms; it's treating the cause
yeah.
of the symptoms and backing
Mm.
out and doing differential diagnosis to find out what is the true cause. And I tell patients, you can have 10 different things, each contributing 10% to the problem.
Mm.
So as you get rid of one
Exactly.
thing, you can still have the problem, but now you only have 90% cause. We just have
Mm.
to figure out what the rest of it is. And so
Mm.
some people think it's like a 1-to-1.
Yeah, no, yeah, you're totally right. So that's part of the PMF efficacy is to be able to target the source of the problem. So this is what we're looking for.
Right.
And sometimes the liver doesn't work well, but it's not because of the liver; it's because of something else. And we need to find that something else and address the proper frequency of that.
Yeah. Yeah. Forensics. Right.
Yeah, even
That's
yeah,
right.
no, exactly. Even like when I was like in Dubai, I had like a patient, a diabetic patient in Dubai, and I was using the most efficient diabetic protocol I could create at the time, and I didn't have any result with him. I was like, "Gee, what's going on? Is he part of the 3% we can't reach, or the 1% we can't reach?"
Right.
And then I started treating his mental health, as a just like he was like PTSD or something. And then all of a sudden we were back on track on the A1C level. So I thought, okay, there's something going on. And then I spoke to a colleague of mine at the time in Dubai. We were sharing the same clinic, and Dr. Simpson was saying, "Oh no, I'm quite sure that sometimes the brain is tricking the liver and the pancreas, so they think they are diabetic, but they're not. It's the brain tricking them." So I said, okay, so then I'm the right path, and that's how I got rid of his diabetic condition with that patient by treating his brain instead of the regular diabetic protocol.
That's awesome.
Mm.
Just to be able to step outside and say, well, you know what, we've got some other things to try. like versus what you said. It's like, okay, we've done all we can do. Good luck.
Yeah, no. I'm a fighter, you know.
Yeah.
Yeah, that's why. I'm a kung fu master, so it's not. There is a reason there. I'm a fighter, and I just want like to go all the way in, all in, and when I'm about like finding a solution, we need to find a way. If there is like
Yeah.
something going on, it's because there is something who makes that things going on. So we need to find it.
So there are, with the AOPP, we're in a lot of different countries now. So we're
So,
international. But for people that are in your area, how would they contact you? What's the best way to get a hold of you, and or maybe even set up a way of getting in to get some of this protocol done?
no, it's really easy actually. We are on the internet, and people can find us and call at the clinic. We have a phone number and internet. And what can I say? Most of the time, we're doing live video on Facebook, and Jesus, that's about it.
So you have a Facebook channel that you do. Was it like weekly or every?
Yeah, every week we're doing like a Facebook Live speaking on about PMF. I used to do Instagram a lot like a few weeks ago, but I'm kind of too busy to do both now. But on Facebook, mostly it's in French, so people from all over Canada they can, because I got like people from Alberta and even Vancouver. They came into Quebec to the clinic, so
Right.
they understood French and yeah, but interesting enough, on Instagram it was like always in English. So
Hmm. Interesting. So and
yeah,
then and then on the other side of the coin, if there are other clinics
hmm
that are watching this and going, "Hey, this is something we might want to do,"
hmm
to reach out to you and say, "Okay, what's the best way to create a multi-room treatment facility for this and start spreading out these
yeah.
hubs of treating people."
No, they can contact me directly. My Facebook is very easy. That's my Joseph J Toy. It's my full name, so it's there is nothing personal on my Facebook. It's all about the PMF. And or they can, yeah, they can find me on anyway on from our website. They can write to me from directly from the website and or Facebook, and yeah, we can take a look at that because that's the legacy I'm looking forward to. So
Great.
we need to be able to create something that's going to stay for eternity, kind of.
Well, Dr. Toy, I know we're running out on time here, and again thank you so much for jumping in here and helping me answer questions about PEMF, but explaining how we are using PEMF and how you're using it for PTSD. Is there anything else that we didn't cover that you wanted to make sure that we got out to our members?
Oh, geez, no, I think for a first, it's a good first. I think
Yeah,
it's a good first.
covered a lot of ground. Good.
Jesus, there's so much things to say about PMF, and even me, like for the last 15 years, I've been doing so many things, and I've been impressed much myself. Like I'm not impressed about myself, but I've been myself impressed about what the possibility that PMF offers us to be creative in the field of health care.
Right. Yeah, and that's one of our goals is to with our membership is to do things like what we're doing, where they can see how it is affecting people and changing lives. And like you
Yeah.
said, the wives are saying my husband's back, or the spouse is
Mm,
saying my spouse is back.
mm,
Um, you know, things like that. So those of you that are watching too, that may know somebody that's got PTSD,
uh,
whether it's military or like we're talking about soccer, heading the
mm,
ball, car accident,
yeah,
anything where there's been some kind of a head trauma. Um, this is definitely a protocol that you need to consider to help out
yeah.
bringing that person back to you again.
Yeah, even like for concussion or Parkinson, I think that's PMF is the way to go actually, because like I've been treating so many people having Parkinson's, and the thing that keeps me like very it's a very humbling experience being able to do that with them, because most of the time when they call back, it's not about I'm not shaking anymore. They don't say that. They will say I was so glad this morning I was able to grab a cup of coffee and drink it all by myself, you know.
Right.
And or having my soup, I was like, whoa, Jesus! It's like it seems to be so little things that brings the good out of the people, and
Yeah.
telling me that. So it's very humbling
Giving
to be
them
able
hope.
to be part of that, you know.
Right.
And especially as Alzheimer's, when people are being able to recognize there are people around, and it's like a new rebirth, you know, kind of a person. So
Right.
it's really, yeah, it's a very strange and humbling experience.
Agreed. Well, it's been great having you on, and I'd like to uh,
Mm.
put a bookmark in and have you back on again in future times, and we can talk about what's new and what's going on. And with that, again, I want to thank you so much for your time,
So,
and look
so
forward to chatting with you in the
thanks for having
future.
me, Jay.
You
Well,
bet.
thanks for having me. We're doing like every one of them is doing a great job, and it's all about the PMF legacy.
Right. Exactly.